Nursing homes are designed to provide specialized daily care for some of our most vulnerable family members. Everything from bathing to dressing to medication management. An estimated 1.2 million people receive care at U.S. nursing homes. But this essential part of our healthcare system faces a serious threat, a critical shortage of workers. I'm Tisha Powell.
And I'm Lee Zurich. According to a recent report by the American Healthcare Association, more than 3/4 of facilities face staffing challenges, which prompted the government to implement the biggest change to federal nursing home regulations in 3 decades. Advocates say the new minimum staffing standards could significantly improve nursing home care and safety, but the move is not without controversy.
The long-term care industry says facilities won't be able to meet what one group calls an impossible mandate.
Coming up, we'll show you how to use a tool that could help keep you and your loved ones safe.
But first, reporter Heather Graff has an in-depth look at a plan that aims to solve the shortage.
She was beautiful. Her house was perfect. Not a thing out of place. And food for days. She would cook days in advance for her family.
For Mary Ellen Cross, being a grandma was everything.
It was mostly about grandkids for her.
And with 13 of them, it was practically a full-time job.
Her school sports, dances, recitals, anything like that. She loved it.
But Karen Lambert says for her mother, that time was cut short.
They put her through so much hell, especially the last week of her life.
Mary Ellen was living at Mount Lebanon Rehabilitation and Wellness Center in Pennsylvania when she died in March 2022. She had been there less than a year, during which Karen says her mother fell dozens of times, sometimes requiring hospital treatment.
She would fall, she would get bruises, she would have cuts on her. No one was watching her.
Karen says transferring Mary Ellen from the Mount Lebanon facility wasn't an option, as no other nursing homes in the area had openings.
How do you think the staffing levels impacted the quality of care there?
Terrible. There was not enough help.
She's now filed a lawsuit against the nursing home alleging negligence.
If they would have had more help, if they would have done the things they were supposed to do, she would not have fallen as much, hitting her head. How many times can you hit your head?
When we reached out, an attorney for Mount Lebanon declined to comment. But in a legal filing, the facility denied some of Lambert's allegations and didn't respond to others. The nursing home is now under new ownership. Even so, experts say this is a problem that stretches well beyond that facility alone.
What are some of the ways that patients are impacted by challenges such as staffing shortages?
It's a huge impact.
Lori Smetanka is the executive director of Consumer Voice, a national nonprofit that advocates for the rights of long-term care residents.
The result of all of the short staffing is that people's health is not what it should be. They're declining in terms of their ability to function, in terms of the outcomes that they have, and their quality of life is diminished.
In an effort to fight that decline in care and quality of life for nursing home residents, the federal government has implemented the first ever nationwide staffing minimum for facilities participating in Medicare and Medicaid. It was finalized in April 2024 and includes more than 15,000 homes.
This is really the first major change that we've seen in a very long time, and it's really an important one.
The regulation requires nursing homes to provide each resident with nearly 3.5 hours of care per day at a minimum and have a registered nurse on site at all times. That means thousands of additional caregivers will need to be hired at facilities across the country because prior to this new mandate, federal law only required they have sufficient staffing.
Do you believe it will improve care?
Absolutely.
Though most states already had their own minimum staffing standards, Smetanka says the majority of those fall far short of the new regulation.
The more staff that are available and providing care to residents and facilities makes an enormous difference.
But American Healthcare Association CEO Cliff Porter says it's too strict.
Can nursing homes meet these new federal requirements for minimum staff levels?
Yeah, unequivocally no.
His organization, which represents thousands of long-term care facilities, reports that more than 700 nursing homes have closed since the start of the pandemic. Porter says the mandate could lead to even more.
We don't have enough staff now. And if you make a requirement to hire more than what currently exists and no plan to help address supply, then I call that a recipe for failure.
To help long-term care facilities achieve compliance, the final rule provides a staggered time frame that will take years to fully implement. It also offers exemptions based on workforce unavailability and other factors.
Will that help ease the transition at all for facilities?
Well, I mean, on the surface, it would appear that way, but the structural workforce shortage has existed for decades. So to think that we're going to automatically somehow resolve this structural deficit in 2 years is not a realistic expectation.
Even so, Porter acknowledges the problem with staffing needs to be addressed.
These are very vulnerable people and folks that need care, and there has to be a system that has accountability to ensure that providers and operators are doing that.
Smetanka says there's a simple way to improve recruitment and secure the employees needed to care for hundreds of thousands of older Americans.
They need to be paid more. They need better training and better supervision, and they need to be supported so that they also are not only being able to take care of themselves and their families, but then translate that into better care for the residents that they're responsible for.
Back in Pennsylvania, Karen says she will continue to seek justice for her mother.
She should be here with her grandchildren, with her great-grandchildren.
And a better tomorrow for so many others like her.
No person should ever have to go through what she went through. She did not die with dignity.
While patient advocate groups like Consumer Voice call the new mandate an important first step, it's also faced legal pushback. In May 2024, the American Healthcare Association, along with the Texas Healthcare Association and several long-term care facilities, filed a lawsuit against the Centers for Medicare and Medicaid Services for exceeding their statutory authority. A few months later, a coalition of 20 states filed a similar suit saying the rules should be vacated, Iowa Attorney General Brenna Bird calling it an attack on senior care. As for non-compliance consequences, facilities that don't adhere to the mandate could face potential monetary penalties, payment denials, or provider agreement termination.
But under the current system, Americans do not give nursing homes a vote of confidence. According to a 2023 Gallup poll, 7 in 10 Americans feel uncomfortable with living in a nursing home, with quality of care being the top reason.